The consequences of physician burnout are very significant. There are implications for both individuals as well as the organizations that they work with. Just as a matter of fact, the American Medical Association just about 6 months ago said that the consequences to the health system, or the national health system, is at a point of national urgency, and they're urging all CEOs and boards of directors to take a close look at it. The consequences to individuals, so physicians themselves, mostly are around physical consequences, psychological well-being consequences, impaired relationships, drug and alcohol abuse is on the rise, and physicians are now known to be the highest rated or highest ranked profession that is attempting or committing suicide. So the consequences to individuals is quite severe and quite painful. To organizations, it's just as dramatic. We're finding in some of the studies that I've been looking at that a 1-point increase in physician burnout correlates to about a 43% increase in the likelihood that the physician will not provide the same level of quality care as they once were. We're also seeing that the cost to replace a physician who leaves the profession early, retires early, or moves on to a competitor, it's roughly $500,000 to $1 million to replace a good doctor. So the consequences to individuals, of course, they suffer, their families suffer, and then the organizations that they work with, there are obviously financial repercussions. Also studies showing that there are implications for higher rates of medical errors and quality of care declining as physician burnout increases. Physician burnout is primarily caused by organizational issues that cause long-term chronic stress for physicians. Things like an increased workload, loss of control or loss of autonomy over their work, so the changing nature of the work that the physicians are practicing in. We're also finding an increased rate of burnout in physicians who are working for practices that have very inefficient processes or older technologies that are causing their workload to change. In addition to the organizational issues that are causing physician burnout, I in my practices have also noticed that individuals who don't have coping abilities to deal with the stress and the complexity of the changes that they're experiencing often experience burnout at a higher rate. I've seen a number of organizations try some pretty cutting-edge approaches to preventing and reducing burnout. The one thing I highly recommend, though, is that we don't take a one-size-fits-all approach to looking at what's causing burnout or how to prevent or treat it. The organizations that I've been looking at are all trying very different things. The evidence coming out of them is still pretty new. But the first thing that organizations need to do, and I think is the most important critical step, is to diagnose it. So in order to really treat it and understand what solutions will help individuals and help alleviate some of the stress in the organization, we need to first understand what in the organization is causing the stress. The first place we can look for that is in physician engagement data. Now, physician engagement data will provide us some really good indicators of what's going on in the environment, and there are some correlations between physician engagement and burnout, but they're not directly the same thing. So I do also recommend that organizations take a closer look at burnout by conducting something like a Maslow burnout inventory or a mini-Z survey that truly measures what burnout is and can help us understand what the sources of stress are. The second thing that organizations can do is to begin to develop plans to fix some of the organizational issues that are causing stress. So when we conduct a survey, we would gather data that would help us understand and plan for some of those organizational issues, things like supply chain, things like inefficient processes, increased workloads due to EHRs. We can look at potentially team documentation as a resolution to some of those workload issues. The third thing we would do is look at what are the individuals who are burned out doing to cope with stress. Do they have the skills that they need? Do they have the support that they need to manage through the complex changes that are going on around them? Or is there more that could be done to support them? So some of the work that we're doing with organizations is to develop resiliency development skills and physician well-being programs. Those are proving to be very successful right now. I'm looking at a number of organizations who are piloting different versions of resilience or physician well-being programs and are having some really good outcomes. So I highly recommend that first diagnose the problem, then start to address organizational issues, but don't forget about supporting individuals through the process.